died at a very young age recently from a heart attack. And it's like, this heart series is an important series in our podcast, I think, anyway, because it's the number one killer in the world, stroke and heart attacks. And there's so many things we can do to lower the risk significantly. There are things that not even physicians or even cardiologists are looking at. It's important for the self-health advocate person, right, to be proactive so that they lower the risk of dying from a heart attack or a stroke or anything or any condition. Bring clarity to the confusion of diet. Everyone is confused as to what they should eat to prevent a heart attack, to prevent prostate cancer while you have prostate cancer, to prevent things like Alzheimer's, live longer and live better with age. Everybody's confused, and there's a reason for that. I mean, there's contradictory diets, right? One is, low fat, vegan, vegetarian, plant-based, and the other one goes to the other extreme, carnivore. And I think that people are just confused. And what diet works? Every diet works. If you go from a standard American diet to any diet, you're going to get some results. But the diet that gets you well doesn't always keep you well, as it relates to everything, as it relates to, again, lowering the risk of strokes and heart disease and dying from a heart attack, which is happening more and more, at least in our world and in our age. Just more and more people, you hear the stories all the time. So-and-so died in their sleep from a heart attack and so forth. I think there's a lot we can do. And the first thing is, as I talk with Dr. Khan, Chong, Spar, and Gitig, is be proactive, be an active participant in your well-being. That's empowering, and there's therapeutic value from the empowerment of taking control. And then what do I do? What are the tests? What's the dietary approach? And it doesn't have to be that complicated. What's the lifestyle? The dietary approach. I think if we do that, we'll live longer, but not only live longer, we live longer with quality, and we're engaged with life and people, family. And that's what it's all about. That's what it's all about. The sad truth is that every 30 seconds, literally the time that we've been here talking for the last minute, there have been 2 people somewhere in the world that just died from a heart attack. That's insane to me. And oftentimes you would think, well, they're older. No, they're young, with kids at home. If men only knew that you can really significantly lower the risk of that happening, you are in control, they would do more to prevent that from happening. It's not just going to the doctor anymore. It's not just saying, okay, go to the doctor. There's a system in place that works very well in many situations, injuries and car accidents, and great. And sometimes surgical procedures are necessary. They're great. But in chronic disease, preventing chronic disease and acute and premature mortality, you have to be proactive. You have to ask better questions. You have to say, is this, what other blood panel should I get to really know? Ultimately, what do you want to know? You want to know, what's the health of my arteries without an invasive procedure? That's the goal. Without an invasive procedure, how can I tell the health of my arteries? With Dr. Gitig, who is a phenomenal cardiologist, that's what he does. There's very few Dr. Gitigs in the world. We discuss why that is. Bottom line is that you need to ask better questions. You need to demand more. What are the things that I can look at to see the health of my arteries without an invasive procedure, so that I know where my status is and I know if I need to make changes or even if I need a medication? It's not about preventing pharmaceuticals all the time. Sometimes you need it, right? Before you go for the long runs and the marathons, and the things like that, look at the health of your heart and the health of your vascular system. So I think it's very important for people to be more in control and, spend some time. What do we do as men? We think of our business. We think of our money. We think of how to grow our money, how to invest our money, how to make more money. Great. That's an important component of life. Our relationships with our kids and our spouses and parents, if they're alive, and siblings. Great. But more time needs to be spent on each element of your health from head to toe, even just quarterly, and asking the right questions and being more proactive. Ask the right questions. What are the right biomarkers that I need to look at? It's not, LDL or HDL, triglycerides. What do I need to look at? What imaging do I need to look at my arteries? Ask the right questions. Request to be monitored properly by a physician. Be proactive. Be a participant in your own healthcare. And that's the only way that we're going to be able to prevent these situations and leaving families behind and leaving your kids and family and dying prematurely. You have to be proactive. So this heart series is really important, I feel. One can argue that the 100 episodes that we are approaching is all important for sure, but I want to make sure that this heart series gets the attention that it deserves.